The other test, which might be easier for some folks, particularly if they have a very large leg, is it's called the anterior and posterior drawer test. And you can bend the leg to 45 to 90 degrees. And then most folks actually just kind of sit on the, stabilize the foot by sitting on it. I'm just going to sit right here. Let me know if anything's painful. And you grab both hands around the leg, around the tibia, and you want to pull anteriorly, checking the anterior cruciate ligament, and also push posteriorly to check the posterior cruciate ligament. Again, you're looking for any pain or laxity of motion here, and this is a normal exam. And again, to compare to the other side is important. The final exam we'll do is called the McMurray test. That's a test for a meniscal injury. And to do that test, you're looking for inability to extend the leg at the knee, or any pain or popping when you do this maneuver. And to do the maneuver, you need to encircle the anterior part of the knee, so your palm needs to go over the kneecap, and either your index or your middle finger and your thumb have to go over both the medial and lateral joint lines here. And I'm going to bend your knee up all the way, and you want to turn the lower leg, you want to turn the foot medially, and then extend the knee, looking for any pop or crepitus. Any trouble there?
Yeah.
Okay. And then you want to rotate the foot laterally and do the same maneuver. Just extend the leg, feeling for any crepitus or pop here. Okay, good. So, good knees, Bill.
Thank you.
Okay. So again, we've examined both the hip, the knee, and the ankle by inspection, palpation, and then passive range of motion, although you'd also want to include active range of motion in a musculoskeletal exam. We also did some special maneuvers to look at ways to assess for knee injury. I'd like to thank Bill for helping out today.
Sure.
Thank you. Next, we're going to move down to the ankle. And we're going to just, again, inspect the ankle for any obvious deformity, swelling, redness, bruising. And then we're going to palpate the ankle. We're going to palpate the Achilles tendon, the medial malleolus, and the lateral malleolus, and the midfoot for any tenderness or pain. Any of that bothering you, Bill?
No.
Okay, good. Then we're just going to assess the range of motion at the ankle. So I'm going to support his leg, and I'm first going to check flexion at the ankle by grasping his midfoot and pointing his foot towards his head to dorsiflex his ankle. I'm going to point it away from his head to plantar flex his ankle. I'm next going to check inversion and eversion. I'm going to support I'm going to grasp the foot at the heel. And I'm going to rotate the foot towards the midline. That'll be inverting the ankle. I'm going to rotate it away from the midline. That'll be everting the ankle. I'm next going to check adduction and abduction of the foot. So I'll first abduct the foot by moving the foot away from the midline. And then I'm going to adduct the foot and move it toward the midline. Now we're going to go ahead and look at the range of motion of the hip. We're first going to look at flexion. I'm going to flex your hip up and then bend your knee, and we're going to try to flex this as far up in the abdomen as you can. And you should normally get about 130 degrees of flexion here at the hip. And have you straighten your leg out, and then pick your leg up with the knee extended, and then you should normally get about close to 90 degrees of flexion here. And Bill's got good loose hamstrings, so he's pretty limber. Now we're going to go ahead and check for internal and external rotation. So I'm going to bend your hip and bend your knee to about 90 degrees. I'm going to internally rotate the leg, and sort of paradoxically, when you internally rotate the leg, the foot goes to the outside. And when I externally rotate the hip, the foot's going to go to the inside. Okay, any soreness or pain there? Okay, good. I'm going to abduct or abduct the leg at the hip. So I'm going to pull the hip away from the midline. Okay. I'm going to adduct the hip and pull it towards across his body until the pelvis starts to come up off the table, and he's just starting to rotate now, so we'll stop there. Okay. I'm not going to go ahead and take a look at extension of the hip while he's standing. This is a fairly easy way to do that. So Bill, if you could just move to the table, and I'll hold it up for you. If you could just sort of support yourself here so we don't lose your balance. and try to stand up straight. I'm just going to reach down and support your leg, and I'm just going to extend this back. And you would expect this to extend back about 20 or 30 degrees. Thanks, But you can also do that in the prone position. And we're going to go ahead and first just inspect the knee, looking at the patella, at the bony landmarks, both at the normal concavities on either side of the patella and below